My name's Andrea. I'm the CEO of the Parkinson and Movement Disorder Alliance, and it is my extreme pleasure to have the chance to speak with the president and CEO of the Parkinson Alliance, Ms. Carol Walton, and also announce some big partnership opportunities that our two organizations have collaborated to come together on. So welcome, Carol.
Thank you, Andrea. So pleased to be here.
Yes. And I thought that we could start by first sharing a little bit about the Parkinson Alliance and the founder, the philosophies, the reason why, and then learn more about you. And then move into, the new collaboration that we have together. So,
Terrific. I
Carol,
love it, Andrea.
please.
Your questions
Yeah,
are always, they're all in the same breath, but they're like 30 years all in like one question.
yes, which is not an easy feat, but if anyone can do the whirlwind time machine, but we have time to not be rushed. So, Carol, tell us about the Parkinson Alliance and Margaret
Right.
and all of that founding story.
Let me start a little bit with Margaret, because that's really a good lead into the Parkinson Alliance. Margaret was diagnosed at 38 back in 1982. So although that was called young onset, they really didn't have a name for it then. And she became very frustrated because there was very little information about her disease. So she started doing a lot of research, and she really became kind of for the community a resource that people could go to when they were newly diagnosed and help families understand at least as much as she did, and sharing stories of some of the other people. And then in 1994, her husband, by the way, had joined a lot of boards, was on APDA, and then it was on NPF and was on PDF before they merged and all that. So both very, very active in the community. And in 1994, they had the first Parkinson's Action Network, Joan Samuelson's organization for public policy. And they both got very active in that. Interestingly enough, that was also the first year of the Parkinson's Unity Walk. So they were both on the same schedule. So they got very, very active in that, and also very active in doing the work of getting the Morris K. Udall Research Education Act passed, so that centers of excellence and our Parkinson's researchers and the government would have more research into Parkinson's. And that's actually, I went to the second forum. That's how I met the Tuchmans. And just to kind of give you an example of some of the things Margaret would do, obviously they had a very big home, and she had, on one end of her house, she had kind of a big office with like 8 computers, and she would fill them with volunteers every day. And one of the last big pushes to get the Udall bill passed, there are 435 congressional districts. She bought hundreds of thousands of postcards and found one volunteer in each of those 435 districts. Then she would send the postcards. She would put stamps on them. All these people would put stamps, real stamps on the postcards, send them to people in the 435 districts so that they could be sent from their own district to Washington, D.C. So it wouldn't like it was all coming out from Margaret Tuchman's house. So when she decided she was going to do something, it was not on a small scale. It was on a big scale, whatever she wanted to do. So that's just kind of a really good example. So that's how I really got associated with them. And then they realized after going to the public policy forum that there was tons of great research that was needed, but not enough money. So they decided they wanted to start their own foundation. And I was introduced to them a couple of years before, and They decided they wanted to start their own organization, but I was in San Francisco and they were in Princeton, New Jersey. So they convinced me that it would be a good thing if they moved me to Princeton, New Jersey, which they did in October of 1999. And we started the Parkinson Alliance. So we started doing, events in the Parkinson's area. One of our first big events was the LA Marathon and Team Parkinson. And actually that went for over 20 years. And that also added a lot of really nice money to the Unity Walk. And interestingly, that in the mid to late 90s, Margaret decided that she really needed a therapy to help with her Parkinson's. And at that point in time, the Michael J. Fox just started, and we all thought that it was going to be embryonic stem cell. That was what was going to be the cure to Parkinson's. So she wanted to do something that was reversible. And that's why she finally decided on deep brain stimulation. And she had it way before it was FDA approved in early 2000. And it was good for her, but it was very frustrating because she just could not imagine the lack of information that she had such a difficult time finding. And that was what really got her on this path of, we need to get more information, and we also need to make sure that we hear the voice of the person with the disease, because that's how she believed that doctors were going to learn more about this disease. And today you still meet researchers that have never met a person with Parkinson's disease. Just stop and think about that. So, and one of the first things she did was do this beautiful poetry book. And of course, she had people from Australia and New Zealand and London and Chicago and California. And we had to fly them all in when they announced the book. And they announced the book at the Parkinson's Unity Walk. So that's another example. And she knew by that time the importance that everyone's Parkinson's was just a little different, and why it was so important to hear everyone's voice and hear everyone's story, because we could all learn from that. So shortly after I got back, they moved me in 1999. Marty was already on the board of directors of the Parkinson's Unity Walk. And they said, Carol, would you like to join the board? So I joined the board, and about 4 or 5 months after that, the co-founders said, Margot's symptoms were getting a little worse. And she said, I know you don't have a really big office or staff yet, but she said, would you consider taking over the operations of the Parkinson's Unity Walk? I didn't know what I was going to do. So I said, sure, why not? And that's how the whole thing started for the Parkinson's Unity Walk. And interestingly, that at that point in time, they had made $1 million for research. And the first event that we were going to take over was in 2001. And at that point in time, the walks were in September. So guess what happened 2 weeks before the first walk that we took over? 9/11. So we obviously had to cancel. And the community had been talking about the fact that since April was Parkinson's Awareness Month, we needed something really big to celebrate that month. So we decided maybe we wouldn't have to wait 2 years. We could do 18 months. And that's how we started the Parkinson's Unity Walk in April. Took it over, and it only had made $1 million for research. The first year in 1994, they had 200 people, made 16,000. And later we'll talk about how we just divested the Unity Walk with over 29 million and 11,000 people attending in 2019. So it got to be a year-round event, if you will. So maybe we want to talk a little bit about Margaret and research and starting the surveys. Let me know when you want me to stop and you want to throw in a question.
Well, I feel closer to Margaret, and I didn't realize she got DBS before it was FDA approved. Like, that is really gutsy. Can you imagine?
She was a pioneer in so many different ways, Andrea. And I got to tell you something, oh my gosh, we didn't understand that much about it. And she had a meningioma. Oh, you're not going to believe this, a meningioma that they found. And she had that taken out 2 weeks before she had DBS, because the neurosurgeon didn't want the burr holes to heal up. So they took the meningioma out. Obviously, it was not malignant and all that, but we were in NYU with that surgery, brought her home for a few days, and then went back for deep brain stimulation. And she had it done all in one day. So it was like 12 and a half hours. She was not only a pioneer, she was one of the toughest people I've ever met for dealing with all these issues and pain and all that. And, you know, the doctors were wonderful. They actually let me, I wasn't in the OR that day, although I've been in 18 ORs to observe this surgery since then, but they actually let me sneak into the recovery. And I can't even tell you, 12 and a half hours. And that woman was like, so with it after all this. And it was like hot in the recovery room, and she wanted me to get some air conditioning, and she was very demanding right after that 12 and a half hour surgery. But we learned so much from that. We had no idea what to do when we brought her home or what we should really be prepared for. And it's so interesting. We've learned a lot about this. They actually took her Xanax away from her without weaning her off. And for 3.5 weeks after her DBS, we couldn't figure out, she couldn't sleep. She kept having all these muscle spasms. It was absolutely unbelievable for 3.5 weeks. We would take her up to New York and she would crawl around the waiting room because she couldn't relax. And then all of a sudden it went away. And believe it or not, it took a year. And finally, one of the doctors figured out that because they had taken her off Xanax so quickly and not weaned her off, and she'd been on that, even on a low dose for 20 years, that was a reaction to that. Really good lesson to understand. Some medications you can come right off of, and some you can't. So then she decided it was really important to have more research, to educate people more, and to make sure that people with the disease had a voice. So she said, we're going to start doing surveys. So the first one, we had people from the West Coast, because I had just moved from the West Coast and knew some people out there. And we did it for DBS people only, because that's all we had. And by the second survey, we decided it was time to really broaden out and include more. And we had this phone call one day. I left the office and they said, somebody named Jeff Wertheimer called and he wants to know how DBS works. I said, great, so does everybody else in this country. So I called him back, just the nicest guy. And to make a long story short, we hired him on an hourly basis. He was a clinical neuropsychologist, and then he was in Detroit. He then went from Chicago, and he's now at the head of all clinical research and training in Cedars-Sinai in Los Angeles. And that was just an absolutely such a wonderful move for that crazy first phone call. And we actually worked with Dr. Wertheimer until 2017, when it just got to be a little too expensive to do all the paper and pencil surveys and all that. But he was such a huge help. And if you just think about all the non-motor symptoms that we have and all the issues that people really need a psychiatrist or a clinical neuropsychologist to help, it was just absolutely wonderful to have him on board. So we started doing these surveys. And of course, the first ones were paper and pencil, and Margaret didn't ever want anyone to have to pay for anything. That was her first objective. Secondly, she said, I don't ever want to see a report that doesn't have, first of all, I want you to explain the topic to people. Secondly, we have them answer questions. And then thirdly, they always have to have a place to go. Don't just give me data without telling me where to go for answers, where to go for help, because I think that's really important. And if you look at the outline of our reports, which we may get to in a little bit, one of the last parts is called the take-home points. So there's always good places to go, phone numbers, organizations, tips, little stories from people, that have had, help with a certain symptom we're talking about. And she was always very, very clear on that. And even until the very end, Margaret passed away in December of 2018. We would fly Dr. Wertheimer back twice a year. And Margaret had eyelid apraxia, which is very difficult to open your eyes. So it got to be very difficult for her to read. So Jeff would come back and we would sit there and we could talk about different topics and what she was interested in. And she had a lot of feedback from the surveys, because every time people would send in surveys, they would come into the office, we would enter the data. And then at the very end, Margaret said, I always want you to have a question, like, do you have a question that we could help you with or answer? And then she said, Carol, you're going to get on the phone and you're going to answer these questions for people, or you're going to find help or whatever. So we would have dinner every night when I was in town, and I would take surveys over and I would read them to her. So she'd get a feeling of what people were saying without, having to read it herself, what the trends were, those kinds of things. And then she'd say, if someone would ask me a question, she goes, now listen, you get on the phone, you go back to the office and you get on the phone and you answer these questions. And I would call people and they'd say, I did ask a question. Wow, thank you for calling. Can you remind me, what did I ask? So I would remind them, and that would go into a whole conversation. And for anybody who knows me, the first thing I'm going to do very politely is say, can we talk about your doctor? Can you, is the person a real movement disorder question? That had to be the first thing that we talked about. And then I would tell them why they needed one. And then, of course, it was like, good, can you help me find one? And then you would help them find one. And then they'd call you back and they'd go, well, they want me to wait 8 or 9 months. Now what can you do for me? So you kind of had to figure out, lucky you still got some cell phones of some doctors, or you network with the people that answer their phones, or you figure out how to somehow get these people some help without waiting 9 months. And thank goodness that was one of the best things that happened during the pandemic, because during telehealth, there's so many people. Dr. Farmer, as you all know well, was the last movement disorder doctor that Margaret had. And thank goodness I was able to get so many new patients in with a telehealth visit. And boy, I tell you something, even doing that, I had so many people call me, the brand new people, and say, just being able to talk to a specialist on the telephone, someone that said, you know what, you have a whole life ahead of you. It's not over, even though the primary care doctor told you, take Cinemat, come back in 6 months, and there's not much more I can do for you. There's no cure. So just being able to get, some of those people on the phone with her was absolutely wonderful. So we started doing the surveys. The first one had 50 people, and we ended up, in the middle years, we had over $1,500 for 1,500 participants for one of our cognition surveys. That was one of the biggest and most important topics that we had for people. And, it would be, some people would they'd send it in and they'd say, I'm so sorry, but my spouse is in a nursing home now, but we don't want to miss one of Margaret's surveys. So it may take us a little longer to fill it out. And to think that someone would sit in a nursing home and ask questions to some of these people and fill them out and send them back. And some of these surveys, Jeff was a great researcher, but some of them were 8 pages on both sides. That's 16 pages of questions. And people would say to me, how do you get people paper and pencil to fill out all those questions? And I'd go, they're very loyal to Margaret, and they used to really find the data really helpful. And I think one of the most helpful things was that, as we know, because everybody has a little, their Parkinson's is a little different, but the symptoms are the same. And to look at what other people are going through, it's so validating to people. And as we know, sometimes when you get Parkinson's, you tend not to go out or be in a group, and you tend to kind of stay home. And to look at all these different stories and symptoms and to put an infrastructure around it. Sometimes I'll never forget, and I know you're probably going to get into this in a little bit, but the survey we did on urinary symptoms. One of the things that we would do is talk about the issue and get some examples of, what kind of issues people have, then ask them the questions, then talk about what they can do or who they can go to or what the specialist is. or the kinds of questions they should ask. And I'll never forget one of the first calls I got when we did that report. This gentleman called and he said, if I just could have had page 1 of your survey, not even the report, that explained what these issues were, I could have saved myself 3 specialists that didn't know what I was talking about. So when you got those kinds of responses from people, you knew you were helping people and adding some value.
Absolutely. And I think sometimes introspection in general, so I wonder if filling out that was just as beneficial to reflect on, okay, what are my symptoms, and go through those detailed questions.
I think that must be one of the reasons that they did it, Andrea, because we had, I know it was like 16 single pages, 8 double-sided for the biggest ones we did that had 1,500 people. And
it's like the SATs.
Pardon me?
That's like the SATs or the MCATs.
Exactly right, exactly. And we
but it meant for a lot of richness in the reports that were generated out of it.
And the breakouts that we would do, which is one of the reasons that, the reports also became very long too. And sometimes the printed reports would not be quite as complete as what we could do on the website, because there were just so many charts and so many graphs. But, people like to know, what age did people get diagnosed? How long had they had it? What age were they when they first received their diagnosis? Did they have DBS? Which side did they have it on? Did they have it in 1 stage? Did they have it in 4 stages? When we talk about cognition, when we talk about anxiety, what are some of the coping techniques that people used? We would have charts, with what's the number 1 coping technique that would people use. And when you're talking about 1,500 people with the disease, that's a lot of data. That's really a lot of data. So,
yeah. Actually, I have one pulled up.
Okay.
The memory and emotional health one. It did have some of those coping questions. So I thought maybe we could just actually take a look.
You're looking at page 7, which is figure 5, coping techniques, ways to improve memory.
Ooh, okay. So let me share my screen. And I can also show now that all of these research reports can be found on the PMD Alliance website, the
Awesome.
Margaret Tuchman Resource Library, and have a little good to see, put a face to a name.
That's nice. That's the first time I've seen it.
Yes, and I'll take a look at the memory and emotional health one. Okay, I'll make this a little bit bigger. You guys always had such good graphics too to demonstrate.
Well, I'll tell you, and we worked with that. They say it takes a village. So the only thing I can still see is continue enjoying PMD resources.
Oh, am I not, Kelly, am I doing the screen share wrong? Can you see it?
I just see the PDF.
Oh, okay. So, okay, then Carol, I think it's on your side that
there you go. Sorry.
Now okay.
Yep.
So you were telling me to go to page 7?
Page 7.
Okay, everyone, I'm gonna scroll. Don't get dizzy. 7. Ooh, I love a good graph. Okay.
Keep going. Let's see. Maybe it's not page. I have page 7 in the written figure 5. Keep going. Coping techniques. Okay.
There we go.
There you go. See, there's that big bar chart. So, when you talk about, I think one of the biggest issues that people had with memory was what is natural aging and normal issues versus what is a problem with Parkinson's. Because as we all know, once you have Parkinson's, anything that happens must be related to Parkinson's. And people do have things that are not related to Parkinson's. After Margaret had her DBS, if she ever got a cold, her husband would say, listen, take her to New York and do an adjustment. I go, but Marty, she has a cold. That's really not about PD, but that's what happens. So we made this chart to show of the 1,500 plus people that were here, what were the coping techniques they used that helped them the most? So keeping items in a visible location was almost tied for number one, with memory and an appointment book. Making lists, they were all up there in the 80s, reminder notes, use of a daily schedule, use of association strategies, cognitive and memory exercises, use of repetition strategies, medications for memory. As we all know, some of the Alzheimer's medications work even better on people with PD than they do with Alzheimer's. And then cognitive rehabilitation was down at the bottom. So this is
how practical that is. It's, these are things that anyone could put into practice in their own life.
Exactly. And you know what I really loved about some of these things? I know one of the questions, that you asked me at one point in time was, what are some of the things that really motivated you and the stories? And I think one of the stories that used to just drive me crazy are some of the stories people would call and they'd say, my family doesn't understand Parkinson's and they're in denial and I can't get them to come to the doctor with me. I can't get them to read a book. I can't get them to do a webinar. I'm just kind of in this by myself and I don't, there's really not, that was just so frustrating. I would offer to talk to the family, but if they were in denial, they probably didn't want to talk to me either. So when we did things like that chart, if you kind of were alone in your family and you didn't have any help, here are some key things that you can do to help yourself. And it was also, when you talk about cognitive rehabilitation, I think we're still in the stages where we need a lot more focus on that and we need it to be easier for people. We did a baseline with Dr. Laura Marsh, who was wonderful, who was at Johns Hopkins. So we drove down to Washington, D.C. It was 8.5 hours of testing over 2 days. Well, guess what? People can't do that. We actually, Dr. Wertheimer and I went to Medtronic Corporate one year, and we said, if we work with you, can we come up with some kind of a standardized test that's maybe an hour or something that's very short and that's very affordable if you don't have insurance to cover it, just to help people, give them a baseline. Because people kind of needed to know, is this a normal baseline or am I worse than most people, or where am I? And I think we're getting better at doing some coverage for insurance plans, but it's still hard. It's even still hard to find like what Jeff does, a clinical neuropsychologist, much less a psychiatrist. So, and those are things that can help people so much. So it's one of the areas that I think we still really need to work in.
Absolutely. And what about an area that you've seen the needle move a lot and, maybe it's even DBS, but what's, over the last couple of decades since you got involved with the Parkinson Alliance, has there been an area of understanding that is just now so different than how it was?
Oh, absolutely. My father had Parkinson's and diagnosed in the 80s, passed away in the mid 90s. I didn't even know how to spell the word, much less. And we didn't have very many therapies then, but what was a movement disorder doctor or whatever? And I actually was working a lot and flying around the country, and I flew back to New York City and I met with some of the bigger foundations, and other than getting a newsletter, I swear to God, I'm not trying to be negative, but I didn't really know much else what I could do when I got back, being on the West Coast with how was I really going to help? So if you look at, And I've told people this, one of the things I try and do every day is when I get someone new or someone that I haven't talked to before, how can I help them get on the right path and tell them what they need to know and what they don't need to know? And I just try to be someone who, if I could have had that phone call to help me with my dad back in the mid 80s or the late 80s, I would have given anything just to have one person that would just kind of put me on the right track. But I think there are lots of trends. First of all, for years, we just had one medical device company, which was Medtronic, and they were wonderful, but we now have 3, plus a lot of other non-invasive, if you will, treatments to help people. But when Margaret had her DBS, we didn't have we just had like constant voltage. We didn't have current. We didn't have anything else. And we didn't have bidirectional leads, which if you stop and think about that, you had this current and it was kind of the splash method. So you have all these side effects that you had to deal with trying to get adjustments and all that kind of stuff. There's been so many improvements. So if you think you can direct that current now, and you don't have a lot of side effects that we had 15, 20 years ago, especially made big improvements in speech, which has always been one of the #1 issues with DBS. And the fact that you can do adjustments over the phone is it's amazing right now what they've done with technology. And, DBS isn't for everybody, but back then we weren't really 100% sure who was a perfect candidate. Boy, we've got that nailed today. They know exactly what a good candidate is and what symptoms it will help and what symptoms it won't help. And I always say, as long as you go to an institution that does a ton of DBS, and I don't mean one a month, I mean like 2 or 3 a week. There's no reason that any system you have, because I get lots of calls going, okay, which company do you think I ought to use? And my answer is, listen, if you are the right candidate and you go to a team that does a lot of DBS, any system you get is going to give you a better quality of life than you had before. So, and that's my standard answer. And I always used to say, I want all 3 companies to buy booths and be sponsors at the Parkinson's Unity Walk. So I don't want to offend anyone. I want all of them, but it really is the truth. If you're the right person, you're going to have a much better quality of life. I also think people understanding that one of the best therapies, and that's free, is exercise. Just go to a support group today. People are in much better shape. And they're so much more educated. Look at the kinds of stuff that your organization does, Andrea. I mean, to think that, boy, that's the last thing we ever thought about 15 or 20 years ago, to be able to just turn on your computer and have a first-class movement disorder doctor that I can either put my little face on the screen and ask them, or I can put my little question in the chat, and you won't tell anybody who I am, but you'll ask the doctor and I'll see that live, like in living color. Just think of how powerful that is for people. And there's so much wonderful education today. And again, that's one of the great results that we had, of the pandemic. We have lots of therapies where we didn't have 15 or 20 years ago. I think that's the good news. And I think sometimes it's confusing for people. We have to continue education to explain all these therapies, how do they kind of interchange and mix and match? And then we have to also work harder to make sure they're affordable. People will say to me, it's great that we have all these new therapies, but I can't afford them. So, what's it going to do for me? And I think the fact that we are now actually working on therapies that will slow the progression or stop the disease, we just dreamed about that before. And I think it's really hard. Sometimes we still need to do a much better education of explaining to people how important research is, how costly it is. And sometimes for the 10 roads you go down, 9 are not going to work. But we now know, I was at a wonderful conference with Andy Grove, as you all know, the co-founder of Intel. And this was years ago. Andy was extremely expressive, shall we say, And he stood up on a table and started yelling at everybody. And he goes, you know, in manufacturing, when something goes wrong, we do what we call failure analysis. Why do you spend all this money on clinical trials and nobody ever figures out what went wrong? And that was really the beginning of trying to figure out why some of these clinical trials did go wrong. Was it that it didn't cross the blood-brain barrier? Was it the wrong dose? Did we have the wrong people? Whatever. And I think that has made a huge difference. And now we're actually working on therapies that have the opportunity to really slow the progression or possibly even halt the disease, and working on vaccines to do the same thing. And with this announcement of the biomarker, I mean, Dr. Tagliati did a seminar the other day and said there's still 25 to 33% of people who are misdiagnosed. Just think, now that we have a biomarker and we've got to make it easier for people, like a blood test and maybe a saliva or a nose swab or something. Now that we know that, what if we are able to have the right subtypes in these clinical trials? Just think about how powerful that will be. So we'll have the right people in the trials instead of maybe some people that we're not even 100% sure they have Parkinson's disease. So I think that's huge. And we also are working more, and I think this is maybe only in the last 7 or 8 years, on all these non-motor symptoms, because that's where the quality of life is. In that same seminar, they are actually talking about therapies that will help Parkinson's disease people with their cognitive issues. It's not Alzheimer's, it's very different. And we talk about PD dementia, it's not the same. You just can't put them all in the same ballpark and say they are. So those are just huge. Those are big issues for people. And if we can just figure out how to make some of these trials a little faster, it will help.
Yes. Well, I know we have some, I recognize some names and faces, and we have some advocates and change makers in the audience. And your story about Margaret with her postcard campaign and the Udall Center funding. Margaret got things done.
Andrea, can I mention one more thing?
Please.
She also decided it was really important to have the voice of the person with Parkinson's, but she also had this crazy dream that maybe we could get the doctors to agree to something. So we did this huge DBS consensus conference, and we flew in neurosurgeons and movement disorder docs, the best from around the world. And we all met in New York City. 65 people, and Dr. Braunstein from UCLA was the head moderator, and we put this huge consensus document together. And boy, that was a very active. Can you imagine, because 2 movement disorder doctors will do things just a little differently. So get 60 and add the neurosurgeons and put them all in the same room. It was a total trip, but they did agree on some things. And Dr. Braunstein helped, put this wonderful report together, which was published in the Movement Disorder Journal and got lots and lots of hits. So that's just another example of the power of her saying, it's one thing, I want everyone to tell their story, but maybe we could get the doctors to agree on a few things, which would be helpful also.
Yeah. And I was going to ask, about making change happen, accomplishing things, getting the Udall centers funded. To me, kind of feels like we haven't had one of those big wins in the Parkinson's space lately. And everyone's kind of, it's log jammed, and, what change has been made right now on the horizon. There's the National Plan to End Parkinson's bill, and that's
Right.
gaining steam. But what, if you were gonna channel Margaret, if she was here, do you think she'd be frustrated with kind of the stagnation? What would she do? What can we do to just get something done?
No, I actually probably feel a little differently, because I've been where there's like almost nothing. And I look at the fact that, yeah, I think the national plan to end Parkinson's is going to be even bigger than UDAL. And I'll tell you why. We have so many more groups now and so many ways to educate people and to make them awareness. Look at, we are all part of the PD Avengers. They're all over the world. And the biomarker thing is going to be huge. I think that's just going to put us all on a much different trajectory. And that was only announced like a couple of weeks ago. And I think you also have, Cinemat is still the gold standard and it still works and it works really well. But these new delivery systems are going to be, some of these new delivery systems where everything doesn't have to go through the stomach, they're going to be like DBS for some people. They're going to be just like another miracle for them. And some of these, like, AbbVie's coming out with their little pump. And Neuroderm is coming out. This is like in the next few months. I have a friend in California that's been in the Neuroderm trial for almost 2 years. She told me she has 10 years of her cognitive skills back. And I have talked to a few doctors who are doing some of these trials. And it's like, we're never going to be able to do trials on all of these anecdotal stories that we hear because it costs too much. But I think the wonderful results that we're going to get for motor and non-motor for some of these new delivery systems are going to be absolutely incredible. And I was very concerned about focus ultrasound for a long time because people didn't understand that it still makes a lesion when you have it and it's not reversible. But two things have happened to drastically change my mind. Number one, we have so many imaging techniques now that the accuracy of doing something like that is so much more than it was a few years ago. And secondly, and I just learned this about 3 weeks ago, when you do focus ultrasound, it's called high-level focus ultrasound. It makes that lesion and it's permanent, but for the right candidate, that's also another tool that we have in the toolbox. But we now know that if you do low-level focus ultrasound, and you do something called microbubbles, which is like an infusion, if the low level will not make a permanent lesion, and you can open the blood-brain barrier for 30 minutes around, give or take 5 or 10 minutes, and using this infusion, you can put drugs in there that will cross the blood-brain barrier. Just think about that, whether you're talking about GDNF or whatever. And that's like an infusion. So it's not like surgery or whatever. That just opens up all kinds of new possibilities. So I think there's some great research that we're now seeing the results for. And I tell people, all the years and every penny that everybody has spent, we would not be here today talking about disease-modifying therapies or all these wonderful therapies that are going to give people a much better quality of life if we hadn't spent all that money and gone down all those tracks, because that's what you have to do. And it's really hard sometimes for people to understand. So I'm probably just on the other side. I just think we're ready to take off. So I'm very excited about all of those things.
Well, that's the power of perspective, to be able to zoom out. And yes, it's just around the corner, because you're absolutely right. We're on the brink. So cool your jets, Andrea. We're on the brink, but stay passionate, stay fighting. But
don't stop doing what you're doing, because having people being able to get questions answered from a real movement disorder specialist, or being able to look at all of our reports, that people have the same symptoms, being able to have access to all that education. It's so important for people to work hard and to stay in good shape and keep up their quality of life, because when something comes along that will drastically slow their progression or even stop it, they want to be in the best shape they can to take advantage of that. So all this is everything that we're doing. And I also think, the former CEO, Todd Scher, and I of the Michael J. Fox Foundation, we used to talk about this all the time. It's like everybody's spending so much on education. But what we really learned was, if you're newly diagnosed, I want to hear what's going to happen to me in the first year. If I get 2-3 years, I want to I want to know what's going to happen in 3 or 4 years. So if I go to a seminar, I'm kind of only going to listen to where I am right now. When I get to the next stage, I'm going to need everything you told me in that first seminar again, because that's where I am. So it's the importance of education, but it's also the importance of repeating and telling them again, because it's sometimes really hard to remember all these things. And just like we say, Parkinson's is different for everybody. So I was in a new support group last week. Every time you go to a support group, every time you talk to somebody, if you really listen, you're going to learn something new. And at some point in time, you're going to be talking to somebody that's going to give them a little helpful hint.
Absolutely. And there is a Parkinson Foundation study that's coming out soon. They did a Medicare claims analysis, and I wrote this down. So of people with Parkinson's on Medicare, 91% do not see a movement disorder specialist. So we got a lot of work to do.
People on Medicare don't see, that's awfully,
Yes, can't wait for that study to come out with the full data. But
yeah.
Yes, there's a lot of education out there, and we field that same question, but then, when you're actually in real life talking to people, or you ever go on some of these Facebook groups, there is still just such a dearth of information, and people who don't know some of the basic symptoms, or don't even know what a movement disorder specialist is. So when you said that was your number one, advice on the phone, absolutely echo that. And I think that's one reason we get along so well.
Andrea, I was on a group that's out of South Korea in London the other day, and this lady was asking a question, and she said, I guess I should maybe go back to my primary care doctor. And somebody said, yeah, that's probably what you should do. So I thought, okay, I can't deal with this. And I took myself on mute and I told them who I was. So I went through the whole lecture, and it was like, oh, wow. It was like these people had never heard of this. Just to think, it's 2023 and we're still defining what a movement disorder specialist is. So all the more reason that your upcoming meeting is like, we need somewhere else to go here. We need some more help. So that's incredible. We need to think of more ways to get people care sooner, and it takes more than 15 minutes, by the way, to see someone who understands Parkinson's and tell them about your symptoms and what you need.
Absolutely. And you mentioned 15 minutes because that is about the repeat visit, average neurologist clinic visit these days.
That's why people need places like yours to come and talk about this and learn from other people, because they can learn from other people. And 15 minutes, even 30 minutes is not going to do it, especially when there's months in between that 15 minutes or the 30 minutes when you actually go back.
Yes. Well, we did have some questions from the audience. Oh, right. How did Margaret find a surgeon and a care team if this was she was the front runner of DBS?
Yeah, well, we knew there were some good people in New York City, and we interviewed 3 different teams. Can you imagine? We took our whole crew up, but believe it or not, the one we chose was at NYU. And I remember they used to do, this is obviously way before the pandemic, they would have the whole team on stage. And we went to a big auditorium at NYU, and each would stand up and give the presentation of what they did. And then we could ask them questions, which is really, really good. So we did choose the one at NYU. And then, by the way, you're going to love this. This is so Margaret. Margaret goes, all right, my DBS, I'm doing really well now. I know all the people. She said, I think you, NYU, you need a website so that we can work with you and we can tell people where to go for information. So we started working on this website with them. Are you ready for the name? rewired for life. Gotta love it. So we kept it up for a while, and like trying to work with them and trying to get, it was like huge. So we kept it up for about 2 years, and then we started our own site, DBS for PD. Actually, it was DBS STN. And then some of the doctors said, Carol, now that we're doing it in GPI and we're doing it in other areas of the brain, what are you going to call? What are you going to call your site? So then we changed the name to DBS for PD without the actual brain thing. So yeah, we
continue
interviewed
to evolve.
and I tell people, you know, you got to make sure that you interview the team. It's not just one person, and make sure you're very, very comfortable with them, very comfortable with them.
Okay, this might be a tough follow-up question. Joan said, sounds like Margaret had some wealth.
She did.
Can the average everyday person, you know, ask the same questions?
You know what? It's an absolutely very good question. And you have to understand, Margaret understood that better than anybody. And she said, I realize, and it's one of the reasons that she started doing all this work. She said, I realize, oh my God, I used to fly from California. She'd go, listen, I want a new doc. I'd fly a DBS person to come and do an adjustment. I'd fly a movement disorder doc. When you have all those resources, you could do that. But her point was, I have the resources and I can do that. And now my job is to provide all that information that I've learned back to people. That's a big part of why we started doing all these surveys and why they were so comprehensive. She wanted to make sure that she could give people the advantage that a lot of people didn't have. And by the way, because I was one of her star caregivers, I must tell you, there are two sides to that equation. And when you have a different doctor all the time, we weren't so bad at the very end, but when you don't like the answer and you start going to a new one, you kind of have to start over because they want your history and they want all that stuff and they want to do some different medications. I would say sometimes the people that didn't have access to all that and stuck with one doctor that was really a good specialist that knew them, sometimes they were better off. So, you know, there's always two sides of the coin, but we did the best that we could to give all the information that we learned back to people to help them. And now that we have all these people and all the organizations are doing stories and we have organizations like yours where you can talk to the doctors directly. It's a much different world, but back then it wasn't. And that's why we work so hard to help people.
And I will give credit that it takes, you know, a visionary front runner like Margaret, who had the resources to make things happen, to determine this is, you know, the way to do things, where the rest of us then can, okay, what are the scalable, you know, solutions where everyday people can have access? And yes, we're not flying around the world to talk to specialists, but like we're here on Zoom today,
right.
We connect, you know, using Zoom and technology to not fly physically, but still over the airwaves, get information from all of the best sources.
And, you know, by the way, I've had so many nice calls, Andrea, from people, because when we did our final letter, you know, closing our organization, the Parkinson Alliance, I said, we're working with another foundation, but I didn't do the name because you and I hadn't finalized everything. I've gotten so many calls from people that said, we're so glad that we still have access to Margaret's work and that we can tell people, because these symptoms are still the same. People look at them differently and they affect people differently. But to have that research where you can go back and it's totally going to be free, just like it was for us, it's still going to be a wonderful, wonderful resource for people. So
absolutely
very, very thankful for that. Yes.
And I'm thankful that PMD Alliance will now have your expertise and, you know, have you under our umbrella as an advisor and a source of wisdom and mentorship. So thank you, Carol, for
You're
sharing about Margaret and Parkinson Alliance and all of this rich conversation that we've had. The Margaret Tuchman Research Library is on the PMD Alliance site, and I look forward to how Carol, how we work with you, and Sarah already sent me a chat. Ooh, that's a good idea for our next survey. What about cognitive impact of the pump? So we can, maybe following that same line of cognition and DBS,
Cognitive
we'll
impact
see
of
as the pump, the AbbVie's infusion pump of the
Yes.
levodopa pump.
Yeah,
Yeah,
both
I know
that
it's
and
being
neuroderma are almost going to come out at the same time. These whole new delivery systems. Yes, absolutely.
we've got our work cut out for us. So
And by the way, Andrea, we don't have to do like 1,000 questions. I think there's still maybe a different format and a shorter format that we can do to still give people a lot of information. So I'm looking at even, different ways that we can still educate people.
Wonderful. We got to continue to evolve. I think Margaret would agree and appreciate and be right there patting us on the back.
She absolutely would be. Absolutely would be.
Okay. Well, thank you again. And any closing words before we say goodbye?
No, I'm so appreciative and so grateful that there is a wonderful way to continue Margaret's legacy, because it's very important. And just like you so clearly stated, she was really a pioneer. She was really a gutsy person. And it's like she did so many things way before her time, but she really wanted to share everything and help people in any way that she could. So I'm very, there were two really important parts of my 23-year career here. One was the Parkinson's Unity Walk, which, as we divested to the Michael J. Fox Foundation, and they had their first walk. They're going to do a great time, and they're going to put resources into that walk that we just didn't have, so they can keep 100% of every dollar going to research. And the other thing that I was so proud of that we did was Margaret's education. And now that we have a wonderful way to continue that and to make it grow, is just, she would love it.
Well said. Well, thank you again. And thank you, everyone. Check out the Margaret Tuchman Library, and we'll see you all online hopefully very soon. Until then, have a great weekend, everyone.
Thank you so much for doing this.
Bye now.